Hello, this is Dr. David Green, CEO of the California Pain Network. The topic today, how to non-operatively treat sciatica. Sciatica is pain that occurs in a person's leg due to a pinched nerve. And this is usually from a herniated disc, although it can also be from spinal stenosis. The sciatic nerve, as you can see here, is actually a conglomeration of three different nerve roots coming out of the spine: L4, L5, and S1. If one of the nerve roots is pinched as it's trying to get out, that causes sciatica with resulting symptoms that usually correlate with the particular nerve root. At any one point in time, 1% of the population is suffering from sciatica. The symptoms depend on which nerve root is being pinched. Most commonly, it's a herniated disc between either L4-5 or L5-S1. So you can see that here. Here's the disc. A piece of it is herniated and is pinching this nerve root as it tries to get out. Okay? That in and of itself is not painful. It's the inflammation that's sparked up by that that causes pain to go down that nerve root. It can be a burning, searing pain. It can have tingling or pins and needles, cramping, numbness, or weakness. The diagnosis is done by first history and physical. So typically if a person has pain going down a certain part of their leg, then they have a positive straight leg raise test like you see here. Lifting up the leg straight in the case of a disc herniation with a pinched nerve is exceptionally painful. It puts tension on the nerve roots. Then the pain resolves when you bend the knee because that takes pressure off the nerve root. So it's highly indicative of sciatica from a herniated disc. Here's an MRI showing a very large herniated disc. Okay, this is the piece coming back. And this is actually the remnant of the spinal cord being pinched. All right. In some cases, a nerve conduction study may be indicated. So dermatomes are when the nerve root comes down, where does it typically supply sensation? All right. We don't all come out right out of a textbook, but the L4-5 disc herniation will pinch on usually L5, and that can cause pain coming through this area, the outside of the thigh, down the side of the calf. And then you have muscle weakness that can occur. That's more concerning than simply numbness. For instance, if you have that L4, L5 disc herniation, it pinches on L5, that can cause a foot drop where you have difficulty lifting up, the foot. When that happens, it's unclear how long it can be watched until it becomes irreversible. You don't have to operate on that right away when a person develops muscle weakness, but it's something that should be closely watched, and definitely not watched for over, say, 3 months, maybe 6 weeks to see if it's getting better. One more thing on that, if you wait too long to operate on a person who has motor weakness, it may never get better, even with a great, technically perfect surgery. Okay? Non-operative treatment for sciatica consists initially of over-the-counter medications, anti-inflammatories, Tylenol, maybe a Medrol dose pack, which is a burst of prednisone by mouth for 5 days. Starts out with a high dose and then tapers off. That can be an excellent pain reliever. Narcotics can be very helpful. Muscle relaxers, because sciatica can often lead to muscle aching and spasms. Neuropathic medications such as Neurontin and Lyrica can help with the nerve pain. And then topicals, such as topical pain creams that might have gabapentin in them, lidocaine. These are great because they don't get into the bloodstream. They don't have any drug interactions. Physical therapy and chiropractic treatment can be very helpful. And then what you see here is spinal decompression therapy, which is computerized intermittent traction, and it's painless. It takes half-an-hour sessions of about a few weeks' time. Interventional treatments, trigger point injections are great because they're very quick. They're just to the superficial muscle, and they can be excellent for people who are having muscle spasms and aching due to sciatica. Epidural injections have been the gold standard for a very long time. Usually these are performed as a series of 3. You can see here one of them being performed. Here's the herniated disc, the pinched nerve. This is a transforaminal epidural where the needle goes right where the pinching is occurring. These are not a fix for the problem, by the way. It doesn't fix the problem of the herniated disc, but it can provide excellent steroid soothing, bathing, anti-inflammatory medication, while hopefully this piece of disc just disintegrates on its own. Okay? These have been shown in dozens of studies to be 75 to 90% effective at pain relief. The outcomes with non-operative treatment have been shown that 80% recover within 6 weeks and 90% recover within 6 months, non-operatively. Okay? A landmark study in the Journal of American Medical Association in '06 showed that the 1-year outcomes are identical between operative and non-operative management. Okay? Symptoms to watch for include what we discussed: muscle weakness. That should be watched closely, and if it's going over, say, 6 weeks, then surgery should be considered. Incontinence obviously becomes a surgical emergency. That's called cauda equina syndrome. Okay? And that should be operated on within 24 hours. And worsening symptoms. So if you have, say, muscle weakness that's getting worse, then that's more indicative that you should have surgery than if it doesn't change. The top non-operative pain management in California is with those clinics affiliated with the California Pain Network. There's multiple clinics throughout the state, all the way from San Diego up to San Francisco. There's over 50 insurances accepted, with over 25 treatment options being provided. For instance, 3 different types of epidural injections alone are provided at these clinics. Over 90% success rates on average for all pain conditions. Pain doctors are board certified and award winning. So visit us on the web at californiapainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green for the California Pain Network. Your pain stops here.